Hi, I'm Dr. James Machino. What are bioidentical hormones and bioidentical estrogen? Well, bioidentical hormones are steroids that are taken from plants and animals, and then they're manipulated in a lab to be identical to the same hormones that humans make in terms of certain types of estrogen like estradiol and estrone and estriol, as well as progesterone and testosterone. Now, the plants that the hormones are extracted from include soy and yams for the most part, and they also take steroids from pigs and horses and manipulate them around. So when they say bioidentical, they've had to take steroids from plants or animals and then alter them to make them identical or similar to what our hormones look like. The treatment of using bioidentical hormones is theoretically based on creating a unique cocktail of hormones for an individual patient based on hormone deficiencies usually identified using saliva samples. Now, this approach is actually in direct contradiction to medical guidelines which support tailoring hormone therapy for individuals based on their symptoms, not on saliva samples. So bioidentical hormones are delivered, as you know, probably with creams or oral routes, suppositories, sometimes even injections. The proponents of bioidentical hormones say that they're safer in that there's a lower risk for sort of clotting disorders or thromboembolic diseases compared to the more synthetic types of hormone replacement, which we call conjugated equine estrogens, things like Provera and Premarin, the drugs that most doctors would recommend. And the proponents of bioidentical hormone therapy also say that using some of the weaker estrogens, predominantly like estriol, which is a much weaker estrogen, decreases the likelihood that breast cancer might occur, whereas in the other types of hormones that were used in the past, they used more stronger forms of estrogen, like estradiol and estrone were the dominant ones, and they have more of an estrogen-like effect. What does estrogen do? It causes cells like breast cells to divide quickly. When breast cells divide too fast, they make genetic mistakes that can lead to cancer. So by using weaker estrogens, they feel that it's safer. But here's the thing. In the year 2004, there was a very alarming study that was published in the journal called Endocrine-Related Cancer by Bardenett and fellow researchers, showing that bioidentical hormone replacement therapy appears to, according to their research, pose the same risk for breast cancer than conventional hormone replacement therapy. So it concerns me a bit. The Food and Drug Administration warned compounding pharmacies not to mislead the public about the safety of bioidentical hormones in the year 2008. Compounding pharmacies were warned by the FDA to stop using the non-scientific term bioidentical hormones, and that was supported also by the Endocrine Society and the American Association of Clinical Endocrinologists. They say you can call these things individually compounded mixtures of hormones. That's the allowable term. They feel that using bioidentical hormones was actually misleading. In early 2008, the U.S. FDA sent letters warning 7 pharmacies that the claims that they made about the safety and effectiveness of bioidentical hormones were actually unsupported by the medical literature, and that they considered their claims to be false and misleading. And so they warned them about doing that in the future. The FDA also expressed concern that unfounded claims made about bioidentical hormone replacement therapy misled women and also healthcare professionals. So what's the bottom line? The bottom line is we don't really know yet if bioidentical hormones are completely safe. To me, the estrogen component of it always scares me. Estrogen is a mitogen. That means it causes cells to divide at a faster rate. Whenever you get cells dividing too fast, they make more genetic mistakes. And I'll tell you this, if there's already some breast cancer there that's lying low and not really, the cells aren't developing, sometimes you can get cancer cells that form, but they never actually develop into a tumor. They're just lying there for the rest of your life and they're dormant. But putting estrogen on them is like putting fertilizer on them, and that can actually increase the likelihood that they're going to grow into a tumor. So estrogen really scares me, whereas natural progesterone, I think, is extremely safe and very beneficial. So I'm not against the whole idea of it, but the estrogen part does concern me. What I think a woman should do first, if she's going into menopause, if she's having symptoms, is to use a combination of natural herbal agents that have been proven to be every bit as good as hormone replacement therapy, but have a much better safety profile. You're not at risk for these adverse side effects that can come with hormone replacement. And as I said, bioidentical hormone replacement is still largely unknown in terms of the safety. So it's all explained in an ebook that I have called The Natural Management of Menopause. I think every single woman should read it. I'll tell you why. Most doctors don't get training on nutrition and natural medicine as part of medical school, and so they're unlikely to talk to you about it. But the scientific evidence is there to support the use of natural interventions to get through menopause. 80% of women can get relief of their symptoms without putting themselves at risk by using estrogens the way I've been describing in this video. Now at machinohealth.com, you'll also see my other review research papers and videos that I've created, footage from my live seminars, videos, other downloads I've created that will help you lead a long, healthy, functional life. And it's not, you don't just want to stay alive, you want to stay functional as the years go by and not get sick. The research articles and teaching materials that I have come complete with all the scientific references, so you know you're getting only sound scientific-based information from me on any health topic that you're looking for. So I would suggest strongly that you use machinohealth.com. It's an ongoing, reliable resource for health and wellness information for both you and your family. Thanks so much for watching.